Good afternoon, everyone. My name is Glenn Spencer. I'm the Senior Vice President of the Employment Policy Division here at the U.S. Chamber of Commerce. Just a quick programming note for today's event. It is being recorded. That recording will be available on the Chamber's website and on YouTube. So again, I want to thank you for joining us today. A quick background on the Chamber's task force to eradicate human trafficking. A few years ago, we established this task force as an advisory group consisting of members who work with the federal government and the private sector to develop common sense solutions to human trafficking and to speak with one voice. The task force develops toolkits to raise awareness and provide education. We host programs like this event today, and we meet with government officials. In addition, the task force offers our member companies a platform for educating the public about their initiative to support trafficking victims, thus giving survivors a voice. Today, the U.S. Chamber and the Alliance for Freedom, Restoration, and Justice, along with the staffing firm Randstad, are unveiling a new toolkit, providing case examples on how employers play an essential role when it comes to crafting solutions and creating pathways to empower survivors of human trafficking. Featured companies and organizations in this publication include Anthem, Randstad, the Freedom Business Alliance, and the Metro Atlanta Chamber of Commerce. This toolkit builds upon an event that we held last year in May titled Business Solutions, Empowering Human Trafficking Survivors. And that broadcast can also be found on the Chamber's on-demand platform at uschamber.com. Now, if you've attended any of our meetings before, you've heard me say that human trafficking is a global problem that affects millions of people each year who are illegally lured into forced labor and sexual exploitation. The U.S. Department of Homeland Security estimates that human trafficking is second only to drug trafficking as the most profitable form of transnational crime, generating billions of dollars a year in illicit profit. In an interconnected world, human trafficking is a global problem that touches many industries and business relationships. Now, business can do a lot in this space, but they can't do it alone. They need to partner with educational institutions, governments, and non-governmental organizations. And the key word, as always, is partnership. Now, on the surface, human trafficking may seem to be an intractable problem, as the crime is hidden, but at the same time may actually be hidden in plain sight. The U.S. State Department, in their Trafficking in Persons report, stated that the COVID-19 pandemic has increased the number of people at risk of human trafficking, as traffickers take advantage of the social and economic crisis created by the pandemic. Overall, human trafficking is a complex problem, and it requires complex solutions at all stages, and a holistic approach is necessary. Now, we know from experience that when educational institutions, law enforcement, businesses, governments, and NGOs collectively join forces, there's an opportunity to solve this problem with upstream and downstream solutions. Upstream measures focus on prevention by aiming to prevent trafficking before it occurs, by addressing underlying risks. Downstream interventions emphasize the importance of remedying the harm once it has occurred. Now, to help with both aspects, the Chamber has developed toolkits and resources, all of which are available on the U.S. Chamber's website. So when you have a moment, even during today's presentation, you may want to download the U.S. Chamber's toolkits with A21 and Truckers Against Trafficking, which instruct businesses about how to look for instances of forced labor in their supply chains and how to detect sex trafficking. These toolkits are joined by the Chamber's Survivor Empowerment Toolkit that we're releasing today with this event. To commemorate National Slavery and Human Trafficking Prevention Month, which takes place each January, the Chamber is hosting today's event, Deterring Human Trafficking. We've got a very exciting program for you to kick off the event. Ashley Chapman, who's the CEO and president of the Alliance for Freedom, Restoration, and Justice, will moderate a conversation with Dr. Hani Stoklosa, CEO of HEAL Trafficking. And they'll be joined by healthcare industry stakeholders to discuss human trafficking victim identification and response. Following that conversation, representatives from A21, Not Today, and It's a Penalty, which are members of the Alliance Against Human Trafficking and Exploitation, will highlight their partnerships with professional sports leagues to inform spectators on how to prevent sexual exploitation. And if you're an NFL fan, I think we'll be joined by a special guest, very exciting during that panel. And then to conclude the event, Michael Billett, who runs the task force for the U.S. Chamber, will provide concluding remarks. So I hope you enjoy today's event. I hope you find it informative and inspiring. And with that, I will turn it over to our first panel.
Thank you, Glenn, and the U.S. Chamber of Commerce, and Michael for hosting this critical conversation, this National Human Trafficking Awareness and Prevention Month. So my name is Ashley Chapman. I am the founder of the Alliance for Freedom, Restoration, and Justice, a human rights lawyer, and have been working on these issues now for over 20 years of my life, trying to end this level of exploitation in all of its forms, labor, sex, and organ trafficking, and working to protect vulnerable populations who are at the highest risk of these issues here at home and abroad. So I'm so thankful, first of all, for the U.S. Chamber's commitment to engaging business and the solution to end and prevent human trafficking. And we're super excited today to be launching that special toolkit on how businesses can empower survivors. And special thanks to Ronstad for sponsoring that effort, but also for pioneering in so many ways what that looks like through their Higher Hope program. We're highlighting a number of different efforts and throughout that toolkit that I know you're going to want to take a look at and learn from and even connect to. So I encourage you to go download that today off the U.S. Chamber's website. This hour, however, we're going to be focusing very specifically on what it looks like for the industry of healthcare to prioritize its response to human trafficking. I have trained hundreds of communities and tens of thousands of advocates over the years, and it would be difficult for me to overstate the importance, the critical importance of healthcare and that entire world coming at this problem in ways to identify it, recognize, respond, even prevent human trafficking at those local community levels. So with me today are two individuals who have been pioneering in that front as well. So both Dr. Hani Stoklosa and Abigail Bolden, wonderful humans themselves, but also wearing a number of different hats when it comes to addressing human trafficking as a healthcare priority. So we're going to take some time, learn from them, get to know them first, and then talk about some successes there, challenges, next steps, and resources for you. So I'll throw it to Dr. Hani first. Welcome, Dr. Hani Stoklosa. Would you mind just introducing yourself, all that you do, and really from your perspective, why healthcare is key in this fight?
Thanks so much, Ashley, and good afternoon, good morning, everyone, wherever you're tuning in from. I'm Dr. Hani Stoklosa. I'm an emergency physician at Brigham and Women's Hospital and the founding CEO of Heal Trafficking. We are a nonprofit that's leading health solutions to eradicate human trafficking in communities worldwide. And our network is comprised of over 3,800 individuals in 45 countries around the globe. This work is a calling for me. About 10 years ago, I was finishing my Harvard emergency medicine training and learned at that point that the majority of trafficked folks access healthcare while they're being trafficked, and the number one place where they access that healthcare is the emergency department. And when I learned that fact, that data had just come out, I thought in that moment of all the patients that I'd missed throughout my time of training, whether that patient from Mexico who had multiple construction work injuries, that nanny who seemed just really afraid to tell me how she got burned, or the teenager who had run away from home and had multiple sexually transmitted infections and heroin use. And I knew that if I had missed all of those trafficking patients, that there was a world of health professionals who were out there, have been in practice, and those that were being trained currently, and they needed to know about trafficking and how to respond. And so I knew in that moment that it was my calling to create a world where anyone experiencing trafficking who comes through the doors of healthcare experiences healing and hope. And Heal has really created a movement in healthcare to do just that. Thanks, Ashley.
Thank you. Thank you, Dr. Hani. So we're going to be learning a lot more about Heal Trafficking. And if you don't already know about that, Hani, where would they go? What is your website? We'll go ahead and throw it out there so people can go learn more.
Heal, Heal, trafficking.org.
Great. Yeah, so we have been highlighting this great work for some time now, so I encourage you to go check all of that out. And we're going to learn more about that in Dr. Hani's experience and thoughts here in a moment. I'm going to turn now, though, to introducing Abigail Bolden, who has been a friend, a personal friend for a number of years now. giving a big shout out to both AmeriGroup and Anthem as early pioneers of a healthcare industry's response to trafficking, and Abby's been at the forefront of that. So Abigail, would you please introduce yourself and from your perspective, why healthcare is critical as a partner in this fight? And Abigail, if you can hear me, I think we might not be able to hear you. All right. So Abby, while we work on that, feel free to kind of jump in there here in a second, but we'll circle back to you for sure. I think Dr. Hani, if we could, what I'd really love to have you share now is just the many different ways. I mean, you said this was really a calling for you about a decade ago, and since then, I know HEAL has been very busy, working in many different fronts to usher in and catalyze healthcare to join this fight. Could you share with us sort of what that looks like and different things that your organization has been doing to engage the healthcare community this past decade?
Sure, happy to. And just to kind of answer in that second part of your question too about why healthcare is so essential, and just as you had reflected at the top, working with local community organizations in the healthcare setting is so key. First, I just wanted to say this is healthcare's wheelhouse. We have done this for many other forms of interpersonal violence, and by that I mean child abuse, domestic violence, elder abuse, and we've actually built wonderful systems of response across the country. And so when it comes to trafficking, it's nothing new, and it's just an extension of that already good work that's being done. I also feel like this is the moment for healthcare to be engaging on trafficking. And what I mean by that is that healthcare is waking up in so many ways to issues of health equity, of social determinants of health, that we have never really been thinking about health so holistically beyond the walls of our healthcare facilities. And trafficking just makes so much sense in integrating that into the work that's being done to address health inequities, to dismantle anti-racism or dismantle racism. And as we're thinking about how do we truly address the social determinants of social determinants of health of our patients, it really plays in so strongly to those upstream and downstream responses to human trafficking that are so critical. And then just finally, if not healthcare, who we know that the majority of those who experience trafficking access healthcare, and that health professionals are really trusted individuals in folks' lives. And we're trained in how to be trauma informed and to connect with folks and to really allow them to trust us so that we can connect them with what they need. So, you know, it just, as we think across all of those different aspects, healthcare is so perfectly poised to be engaged in this issue.
Yeah, so incredibly true. And so I want to circle back to a couple of points there for just a moment. I think that it took a long time, you know, just a very quick history lesson here for our listeners. But really, the reality and the presence and really prevalence of human trafficking did not hit even the international scene until 2000, 2001. And it really wasn't until 2010 when the United States really began to realize that this was an issue that was impacting communities across the US. We now have confirmed cases of human trafficking, labor, and sex trafficking in all 50 states here in the US. And so we're still barely a decade old and catalyzing all the different ways we've got to go about this. And one of the earliest conversations that we were having as a country around this was to tackle this as a public health issue. And there was some pushback against that for a little bit, I think maybe due to ignorance or lack of understanding, but we've overcome that now. And so now we are addressing this as a public health issue in our nation, which is so critical. But even now, and I totally agree with you, Dr. Hani, so I wonder if you could just expound on that for just a moment. When we're looking at ACEs and its implication, so adverse childhood experiences and its application to present day workplaces, so many studies on this right now. When we look at SDOH, so social determinants of health, and how healthcare is taking a look at this, and I know that Anthem has been spearheading quite a bit around this, and AmeriGroup. I know the HEAL has probably been carrying that baton for a while too. So would you unpack for just a moment for those who might have a very limited understanding of how all of this is really one story in a survivor or a victim's life, and how healthcare is most likely going to interact with this?
Yeah, thanks so much for that question. And when we think about trafficking from a public health lens, we certainly know that it's a public health issue. It affects all of our communities and families across this country. And it has not only health impacts, but social impacts in our communities. We know that it requires public health solutions. And what that means is looking at what are those layers of vulnerability to trafficking that result in someone getting in that situation in the first place, and how can we intervene for the patients that we see that are already in trafficking situation, address those risks and help them to go on to thrive, and how do we in our communities really prevent overall risk. And so just actually I could take, I mentioned some patient stories at the top. When we think about someone who's coming into the United States, who's coming into work in a maybe an H-2A visa in the construction sector, how does that individual know what their rights are, so that if they end up in a situation where they're being forced or frauded in that job, or if they're offered a job, that they know what their rights are and how to avoid that situation in the first place. And I mentioned that it might seem like something outside of healthcare's purview, but right now in this moment, with so much with the tsunami of COVID at play, there's also an opportunity there to be interfacing with workers who are essential workers in the United States, whether it's through COVID testing, COVID treatment, COVID vaccination efforts, where we're keeping that workforce safe. That also represents this healthcare opportunity to let those patients know what their rights are and potentially prevent some of those patients from being trafficked, and identifying those that might already be in a trafficking situation. And then to take the third example that I gave of someone with who had run away from home. Actually, the story was that that individual ran away from home because of his sexual orientation, and he was looking for love, but also for housing, and ultimately ended up with a substance use disorder with heroin. And so that individual, when you think about those risk factors, how can we make sure that our youth have a safe place to be and have a roof over their heads? And how can we also increase, housing access across the board? And I know that healthcare is really thinking about these broader community issues as we engage with our communities that are directly linked to social determinants of health. And in these cases, actually directly linked to prevention and intervention with trafficking.
Yeah. Yeah, thank you for all of that, Dr. Hani. So I think that to frame this maybe up a different way, and to kind of press in on a point you just raised. So is that human trafficking, what I try to help communities understand, is really the worst of consequences of compounding vulnerabilities that an individual experiences in their life or in that moment that has made them accessible to a trafficker who would seek to exploit that, typically by promising to meet a need of housing or food or a job for individuals who are seeking something, and then through force, fraud, or coercion, turning that whole situation into a nightmare for that individual, who then feels incapable of seeking help, but at some point typically does seek help from our healthcare providers in many different settings in a community, which is why we're having this conversation today. And so if a healthcare provider understands this and understands kind of everything around this and has been prepared to activate, recognize, and respond to this, well, now we can see identifications soar in communities for both our foreign national labor trafficking population in this country, as well as domestic minor sex trafficking victims or adults. And so trafficking is impacting adults and children, foreign nationals, and our citizens and communities all across the U.S. And healthcare has perhaps the most critical insight into seeing individuals who present themselves to healthcare settings, sometimes some research has shown between 15 and 18 times before they are properly identified. But let's lean back in for a second, knowing now sort of laying that foundation of this is compounding vulnerabilities that occur in an individual's life, the impact of the pandemic on this, and the impact of trying to call healthcare to pay attention to this in the midst of this pandemic. And it feels perhaps, when I've been working with communities all these last couple of years, folks thought, oh, is there a silver lining? Pandemic must be decreasing human trafficking. And hopefully the whole world understands now that is not the case. And we've seen just spikes in trafficking activity, but we're also seeing a spikes in compounding vulnerabilities that individuals experience. But healthcare has so much on them right now, Dr. Hani. So why is it critical even now, even in the midst of all of this, for healthcare to make addressing human trafficking a priority at this moment and not to wait maybe till we're on the other side of all of this, or maybe a year from now to get started?
Yeah, Ashley, you're absolutely right. What we're seeing is that trafficking is compounding vulnerability, and there are unfortunately more and more trafficking victims as a result. So I am acutely aware of how overburdened healthcare is right now. We just had the National Guard in my emergency department last week, and things are just really, really hairy for all of us. But I also think that this is the most important time for us to have this in front of mind, to have trafficking in front of mind. And the reason being that that one moment where someone who's experiencing trafficking in the United States may access healthcare may be right now. And that's related to the fact that folks need to know their COVID status to go to work, or they might need to have treatment and they wouldn't have accessed healthcare for any other reason, or they might need to receive a vaccination. One of the things that HEAL did in partnership with a community hospital in India, so I'm going to take us outside the US borders for a second, is we use that 5 minutes after vaccination time, when you're just your patients are sitting there and waiting to see if there's any sort of reaction and being observed. We use that in partnership with community advocates to have a conversation with patients about their rights, and to know what local resources are available if that person's experiencing exploitation, including trafficking. And so we were able to get that information in the hands of 20,000 patients because we linked it to COVID vaccination efforts. So I think there are a lot of really synergistic opportunities that are unique to this moment in time. And we absolutely need to be thinking about how are we identifying and caring for those that are being trafficked in the midst of this pandemic. And I'll just give one other example. It was a patient the other day who came in for COVID, unfortunately ended up having COVID, but wasn't sick enough that they needed to be hospitalized. And at the end, they were like, doctor, can I talk to you about something? And disclose that they were experiencing an intimate partner violence situation. And that's, in this case, it's not a trafficking situation, but oftentimes we see there's an intersection with both a trafficking and a domestic violence situation. And I think it just gives you a glimmer of how folks know that when they come to healthcare that they can get help more than just for their healthcare needs. So I think the time really is now, and we absolutely have to have this at the fore of our minds.
Thank you so much, Dr. Hani. And we're going to circle back to you here in a moment because I want to unpack some of these solutions, because we've been talking about a lot of difficult truths and opportunities, but we're going to circle back and talk about resources and solutions and examples of things you love. I understand we have Abby back with us, and hopefully her mic working. Is that the case,
Hi,
Abby?
can you hear me?
Hey, great. Yes.
Awesome.
Okay, so we're going to circle all the way back here for a moment. And Abby, just to you now, I would just love for you to be able to introduce yourself and really from the different hats that you wear, your perspective on why healthcare is a critical partner in the fight to end human trafficking.
Yeah, absolutely. And thank you again for patience. We can say it till we're blue in the face. Technology is a gift and a curse, but I'm happy to be with everyone here today. Again, my name is Abby. I am from the state of Georgia. Since 2015, I have worked for AmeriGroup Community Care under the Georgia Family 360 program. What this is it's a single case management organization, our care management organization that coordinates care for all youth that are in foster care, adoption assistance, and youth with involvement in the juvenile justice system. So in my current kind of day-to-day role, I'm the ombudsman, so I navigate and mitigate complaints and concerns as it relates to the care of our children that we serve. But in addition to this, and one thing that I'm sure a lot of people can agree on is the intersection that occurs between youth with system involvement and exploitation or trafficking. So that really kind of got our juices flowing and wheels spinning. And we wanted to start being a little bit more strategic in how we aligned with the work of human trafficking prevention, sexual exploitation prevention. So with that, I've helped lead a lot of efforts, both get started here in Georgia with some initiatives that I'm sure we'll touch on later in today's conversation, but then also got involved in some of the larger work that Anthem is doing in order to be a strong partner and ally in this work. I think this probably has been said, but really, you know, the healthcare industry is just such an essential piece because we know that our survivors are interacting with the various capacity of what healthcare is. So it's an ER, it's a doctor, it's behavioral health providers, it's substance abuse. And so as a whole, you know, the healthcare industry is just such a critical piece in this larger puzzle that we need to have fully together to really impact and support our survivors.
Yeah, I love that so much. And so, you know, I've been walking alongside Anthem now for, I think, Abby, I don't know, 5, 6, maybe 7 years now. And, you know, Anthem, for everyone's general knowledge, and then AmeriGroup, of course, Anthem is their parent company, have been just pioneering some efforts here to really own this as a public health issue, even maybe before our government really acknowledged that. So slow clapping that moment. Over the years, you know, we've been doing national awareness campaigns, especially, you know, concentrated around January as National Human Trafficking Awareness Month. These are some things we're highlighting in the toolkit we spoke about earlier, but over 2,000 Anthem associates have earned their human trafficking awareness badge. They're now trained in how to understand the indicators of trafficking, even just in their day-to-day life, not to mention the healthcare sector. And then Anthem came on board as a development sponsor for what we're calling the Healthcare Response to Human Trafficking series on our online university for justice advocates called Justice U. So, and then AmeriGroup followed with our the Essential Knowledge to Address CSEC series. So for more information about both those series, but I'll shoot it back to Abby to share a bit more about those programs. You can go to learnwithjusticeu.com/healthcare or learnwithjusticeu.com/CSEC to learn all about that. But Abby, could you share kind of that journey and the purpose behind those different trainings and some early,
Yeah, absolutely. So I'll start with locally here in Georgia, kind of what got that conversation going and what led to the pilot program that we launched last year is, again, kind of what I mentioned earlier. So we understand that from the lens that we sit as a health insurance company, that there's so many parties at the table that interact and engage with those that are victims of trafficking. And so that led to us saying, well, what is the biggest way that we can make an impact in a local but a state level? So that led to the partnership or continued partnership with AFRJ and then a local organization here in Georgia, specifically Street Grace, Georgia, to develop a pilot series or a 3-part pilot series. So what that series was, it kind of walked all of our users through kind of the progression of how they could learn about this issue. So it started with our Human Trafficking 101. The second session was, how does this tie to our specific state? So what does this look like here in Georgia? And that's when we really leaned on Street Grace to provide a lot of that content. And then the last piece, which I think is really unique, is we built out 7 different tracks, and each track was tailored to the person, the professional background of the person that would be taking it. So because of our unique positioning with serving all the kids in state custody, we know that there were several different tracks that we needed to build out to really speak to that increase of knowledge that the user could say, okay, what you're saying, that lingo makes sense to me. me because that is my world on a day-to-day basis. So the tracks included specific to those who work at a group home. We had tracks specific to our state employees, our local Division of Child and Family Children's Services here for Georgia, one for our juvenile justice professionals, one for our educators and school counselors, one for our general community organizations that are interacting with these members. We also had our physical health providers, as well as a track for our behavioral health providers. So we had a great response to that, both in terms of diversity and background of professions, but also just diversity across the state. And so we're excited that kind of wrapped up our first phase here in 2021. And we're really interested in looking at ways that we can continue this, offering this resource to those in our community, because as Ashley mentioned earlier, as a whole, we just really understand the importance of kind of that baseline. Do people even know what this is, what to look for, and then what to do with it? And so that's been really core and vital in that training. Additionally, as Ashley mentioned, we've offered the healthcare series, Anthem as a Whole, that kind of is the same model. So the content is very specific. There are 5 different courses under the overarching theme. And really, again, it's to educate our healthcare providers in a way that speaks to them and that speaks their language and is tailored to what they may see in their respective fields.
Yeah, thank you so much, Abby. Yeah, it's such good work, and just we're kind of at the beginning stages of getting this out to on that CSEC series, those child serving professionals who are and have an opportunity, a unique opportunity, depending on what hat they wear in that child's life, to recognize and respond to this. And that healthcare series, we're piloting across the country too. It's available to all healthcare providers, but it is also being piloted within Anthem's network of healthcare providers and AmeriGroup and Blue Cross Blue Shield. So we're just thrilled to see the outcomes of that. And Hani, you'll be excited to know, I think, that whole entire series, moving a healthcare provider from awareness to understanding the health impact, identifying and assessing the situation in real time, how to build out partnerships and protocols within your healthcare setting and your community, were based on one of the assessment tools that HEAL had produced. And so made sure we were checking all of those boxes. So Dr. Hani, I'd like to circle back to you for a moment and just have you kind of share sort of the world of HEAL and what you guys are providing healthcare providers in the healthcare sector in so many ways.
Thank you. That just makes my heart sing to hear that, because we're constantly scanning the healthcare environment through the history of our organization and looking at what are those foundational elements that need to be in place, those standard setting pieces, so that as we collectively create this movement of healthcare response to trafficking, that it's done in a way that heals and doesn't harm. So that just makes me really, really happy. And out of that, we had created that assessment tool for curricula, which was actually used by the state of Texas in implementing their mandated education and training and trafficking law. So it's been really exciting to see the impact of these foundational tools. And I think a lot of folks might not realize that, I said, we want folks to be healed and not harmed, but there are a lot of not intuitive things that health systems may not be aware of that actually could bear risk for them if they don't engage that and engage thoughtfully, involving experts in creating what their plans and their protocol responses look like, and when they're creating their trainings. Just to give one example, some folks don't realize that a victim of trafficking may have been forced to commit crimes as part of their exploitation. And so, calling a law enforcement knee-jerk, the wrong law enforcement at the wrong time, could result in that person being arrested or deported. And so that's just one example of many things that could potentially go wrong. A couple of other foundational tools that we put out there that are being taken up around the globe are the HEAL protocol toolkit that's now being used in over 35 countries globally. That's that A to Z map for a champion in a healthcare facility, so that they know how to do everything from stakeholder mapping all the way through monitoring and evaluation. And most recently, in the last 3 years, to address that gap of those who have been trained and are not trained on trafficking, and recognizing that this does require a high level of expertise, that you don't just sort of learn overnight how to teach this content to health professionals. We collaborated with Massachusetts General Hospital's IHP to create a train the trainer for health professionals. And we've trained folks in 5 countries around the globe now. And what we hear from our alumni is that they not only train thousands of other health professionals, but that training leads to improved responses within those health facilities, whether they be urgent care centers, whether they be hospital systems. So they essentially not only are amazing trainers going back to their communities, but they're also agents of change and leaders that are creating systems of response. So those are just a couple examples to highlight that thinking of like, how do we bridge this gap, and how do we do it in a way that's trauma informed? How do we do it in a way that's survivor informed, keeping a lens of equity as well.
Much. And so what I'd like to do for a moment is kind of turn our attention to what are the challenges and barriers, right? So we know, I hope everyone now has understood the case for healthcare response to human trafficking, making it a priority even right now during this time in our world. But what are some challenges, maybe common challenges, common barriers that each of you might have overcome or seen work, and what might be solutions to address those? So we want to give our listeners, if you're in the healthcare community, an edge here on getting this accomplished. So what do we see? I'd love to ask that. Maybe Dr. Hani, I'll throw it back to you real quick, and then we'll turn to Abby and see what her thoughts are on that too.
Sure. As I look across the country, the biggest barriers are leadership buy-in. You can have that really driven champion who's a nurse in the emergency department, but if there's not C-suite level buy-in to this and investment of resources, it'll last for some time and then sort of fizzle out. So that's why we're here today. So we're hoping to get more of that leadership buy-in. As I talk to advocates who already get it and know that this is something that their health system should be leading in for all the reasons that we've talked about and more, I think it's really helpful to come to the C-suite with data as well as stories. And so working and having survivor consultants to work with you to make that case to your health system, and providing data of the impact of lives as well as healthcare costs that having plans in place can really have, not only improving the lives of those survivors, but we know that many patients who are also experiencing trafficking may be using our healthcare system in acute care settings as opposed to maybe the outpatient setting, for example. And there's opportunities to both make their lives better as well as decrease costs for the system. So I think that both on the challenge end and then solution end, that's what I'd say. And there are certainly, there's health systems that are certainly leading on this as we've been hearing about. And one area that I think is a challenge and also an opportunity to lead is the supply chain piece. And I know systems like Common Spirit Health are thinking about this in terms of their supply and services resource management team and having them aware of risk of forced labor in their supply chains and really thinking thoughtfully about that. As well as, as we think about how to address these challenges, there's an excellent example of a partnership that HEAL has had with a trade association, American Hospital Association, along with Jones Day, where we're able to really think about these issues, whether they be, the best way to respond to trafficking, and how do we make sure that all of healthcare knows how to respond, and how do we think about things like, supply chain management in a leadership way.
Mm-hmm. Yeah, it's so important. Yeah, to really understand that the healthcare industry itself has opportunities to engage this directly with the individuals seeking care, but also through what products or services they are even bringing through those supply chains, or even, and I was having a discussion last week around this with another business, outsourcing services, like cleaning services and laundry services, and making sure that the partners you're partnering with in that community are also equally committed to not engaging in human trafficking or labor trafficking. Abby, I would love your thoughts on some common challenges or barriers from a healthcare industry perspective.
Yeah, absolutely. So definitely agree with what was just previously stated in terms of having that strong leadership buy-in. And I think what that comes down to as well is that buy-in also prioritizes the time that is spent working and what issues are being focused on, because we know that time is valuable. We know now more than ever there is a lot that those in the healthcare industry are being asked to do. So without prioritization and without carving out some time to be able to really tackle this and get involved and immersed in this issue, I think that definitely is a challenge, but it allows for opportunity when the calendars open up some, when those conversations, those relationships are allowed to be built. And I think that kind of plays into partial solutioning too, is, with the availability of having some time, having some space dedicated to this, it is building those relationships. So it's, as I mentioned earlier, healthcare is such a critical and integral piece to this fight, but we're not the only ones. So it's having those relationships with those in other industries, those coming from other backgrounds, to really have a unified front to fight this issue, to raise awareness, to know where to go if things are seen or noticed or identified. So allowing for the time to build those relationships is really key in coming together to serve those that are victims and survivors of trafficking.
Yeah, no, I could not agree more on that. And I was going to ask this question later, but I'll just put it in here right now because I think it is critical here. So partnerships are key, and and having the healthcare community partnering well. If we all are addressing these issues in siloed spaces, it is not going to lend itself to excellence on behalf of caring for victims, on behalf of outcomes of survivors, et cetera. Even taking this as, from the lens of that social determinants of health perspective necessitates partnerships. And what I just love about the Essential Knowledge Through C-Sec series sponsored by AmeriGroup, and you heard it earlier, Abby was sharing this, that third part of the training is almost like a choose your own adventure part of the training, where depending on what hat you're wearing in the community, not just healthcare, not just pediatricians, but juvenile justice officers and foster parents and adoptive associations and teachers and behavioral therapists, et cetera. I mean, this is a whole ecosystem that has to be catalyzed, but it's also a whole ecosystem that has to work together in order to do well here. So tell me, both of you, if you will, I don't care who might want to jump on this right away, but what partnerships have you found to be critical in successfully having healthcare engage this in local communities or abroad?
I'm happy to go first with that question. Since you just were kind of touting the C-Sec series that we had, I think really a great partnership that we have had has been in our nonprofit world, our nonprofit space, specifically speaking to this series. We identified that we needed to be at the table with these conversations and with these solutionings. So we reached out to Street Grace, started having conversation with them. They are seen as some of the premier leaders here in Georgia from a nonprofit perspective in tackling this issue. So we established conversations with them. And then what that did was get us connected with other groups that we could then kind of start introducing ourselves to. I think a lot of the times, or one thing that I've learned with this is sometimes, especially from a health insurance lens, people don't think of health insurance needing to be at the table with this issue. But once I reach out and say, hey, this may be weird, but I'm coming from this background, we want to be a part of it, it's received very well. And it really starts kind of opening up just the minds of those that are fighting this issue to say, oh, maybe we need to think about other groups to be at the table too. So, with that, we sit on the state of Georgia's Human Trafficking Task Force, participate in their work groups there, which again opens us up to just a myriad of different partnerships that wouldn't have been established formally. So it's that one reaching out, which leads to another, and just keeps us all connected in our work.
Love that so much. Dr. Hani?
Yeah, I love that from the top of this panel, we put out there that partnership was so key, and you can't solve complex problems without partnership. And sometimes those partnerships are also complex and nuanced. And, top of my list is partnering with survivors. And I encourage any health system that's engaging in this to think about having really tapping into the lived expertise in terms of labor trafficking, in terms of sex trafficking. Those are end users, and they should be the ones that should be helping us co-design what this looks like. And it seems weird to have to say, but we should be also paying them for that expertise as well. And then when I think about partnerships and what I've seen across the United States, across the globe, it's just really, when I said they're complex, it's just beautiful the way that these can come together. In Alameda County in California, we worked with the DA's office to bring together 5 health systems that wouldn't have otherwise been in conversation with each other to create a regional healthcare framework, because we knew that outside those health system walls, they were going to need to have a common referral pathway. And so why not figure that out together? And we did that in collaboration with the DA's office. We also, I would also make a plug for being connected with local Department of Labor, with worker centers, as we're, again, creating that roadmap of what that healthcare response to trafficking looks like. What I'm also seeing is that there's not as much focus in healthcare on labor trafficking. And so I encourage health systems to really dive into that and dig into that. Labor trafficking may not even be as sort of in your local human trafficking task forces. And as healthcare, you might be inviting that conversation and being that linkage to that particular partner of a local worker center, of the local Department of Labor Wage and Hour Division. So just really want to make a plug for not only what we're seeing being done well, but how do we mitigate some of the inequities that we're seeing in terms of the healthcare response to trafficking, as well as it relates to labor trafficking.
Yeah, it's a critically important thing for us all to understand that trafficking, sex trafficking, especially of minors, gets understandably a great deal of airtime in our news cycles, and those things tend to go viral, on social media. But trafficking is impacting so many humans, and labor trafficking in this country included are individuals who need our very close attention and care. And so bringing that into the conversation, I love that, Dr. Hani. It's important. It's something that I'm finding myself having to constantly say, hey, let's also look at this side of what's going on in your community. And so that's super important. So we're coming in on the final 10 minutes or so of our conversation today. And so I'd like to ask each of you to share, what could you share? So we have individuals listening in today, maybe they're participating in the healthcare community or could be partnering with one. What are some initial steps, that you would suggest as a way and a means of getting started in that effort, if they're brand new to the effort, especially?
I can
go ahead.
I can kick us off here. But I would just say, first of all, do your homework. There are really good resources out there for health professionals on trafficking. 10 years ago, not the case. Now we're at that stage that there's a lot of really good information. Encourage you to check out the Heal Trafficking website, sign up for our listserv. It's free to be involved. And folks are engaging in really nuanced conversations in that space. There is also a lot of misinformation out there. So really also bring your critical thinking lens. Trusted resources also include Department of Health and Human Services, Office of Trafficking in Persons has a SOAR online training, SOAR online training that's integrated into a lot of learning management systems. So you may already have access to it through your existing HealthStream or what have you. So first, take that step to inform yourself on what this looks like, and listen to survivors that are in your community, including labor trafficking survivors, to really understand what the problem looks like locally. And then, I'll give you the advice that I take myself is think about, the unique power that you bring to the world and how that intersects with this issue. And it may be that, gosh, you're already working on substance use issues. And by working on substance use, now you're going to expand the lens of your treatment center to think about trafficking and connecting survivors to resources. And know that even treating substance use is also helping to prevent trafficking. So I encourage you to think about do that inventory and reflection of what are the unique skills that you bring to this, because what you're already doing is going to come to bear on trafficking and ultimately help you prevent trafficking from happening in the first place in your communities.
Mm. Thank you. Thank you for all of that. Yeah. So getting educated, having those conversations, building the right partnerships, all critical initial steps. Love that. Abby, from your perspective, what are some initial steps to take?
Yeah, so to elaborate a little bit more too on what was just said, I would say in terms of that education and awareness, just making sure that not just you, but that those around you have the right information. So I know a lot of times we can operate, go to trainings, learn things, but then how do we take that back to those in our workplace, even in our communities, to make sure that the information, the knowledge, and the resources is shared, and it is shared and it is correct information. Additionally, I would say, start looking at what tables are we not at. Once you start learning what's going on, then how can you plug in there where you think that your voice, and you know that your voice or the voice of the industry that you represent needs to be there. So what table are you not at? And then who's not at our tables? So when we're addressing this issue, who else do we not have, or who do we not have to really fully help us make informed decisions and plans and trainings and educations to impact our day-to-day work?
I love that. I think I love that framework. That's really fantastic. So we've mentioned some tools and some resources that are out there. So thank you for all of those things. And so we've got, HHS has SOAR training. Anthem's got their healthcare response to human trafficking series. HEAL, I know, has the listserv that we encourage, especially individual HCPs, to jump on board with. Could you share a little bit more about sort of that universe of activity, Dr. Hani, and how an HCP might benefit from signing up for that?
Yeah, so we are sharing the latest evidence-based resources for health professionals on trafficking in that space. So for example, there are now core competencies for those that are doing education and training for health professionals on trafficking that HEAL co-created with the Department of Health and Human Services. That's something that we shared there. When the latest of research is coming out, the latest, there's now a labor and sex trafficking adult screening tool that just came out in 2021. Those are the kinds of things that you're finding out about in real time. And then, of course, we have a number of different ways that folks can get engaged in conversation with others, as well as resources they can bring back to their health systems, whether it's that, accessing the HEAL protocol toolkit, or accessing some of the training and technical assistance that we do. So we go alongside health systems and help them along with our toolkit to actually put that toolkit into action. Or, accessing our HEAL Speakers Bureau, which includes a number of individuals with lived experience who are able to talk about their labor and sex trafficking experiences as it relates to healthcare and give advice to health professionals about how they can respond. And that can be so powerful in opening those initial conversations within your health system. So those are just some examples. And also to sign up for the HEAL Train the Trainers, right now we're doing it yearly. Right now it's virtual. It'll be this fall in October. And just another way to not only get yourself informed, but to build those teaching skills and those leadership skills to be an agent of change.
Absolutely. Well, I think that's hopefully what everyone who's tuning in today wants to be, an agent of change. I love that. So let's do final takeaway. So I'll throw it to Abby first. If there's one thing, if it's two, it's okay. But if there's just a main takeaway that you would like our listeners to walk away with from this particular session on addressing human trafficking as a healthcare priority, what, from your perspective, might that be, Abby?
Yeah, and it probably comes as no surprise, partnerships. So making sure that you're connecting and you're establishing those relationships with those that are in the fight. We're stronger together. We need the full puzzle together. So really work on identifying who those relationships need to be and really hone in on that.
Love that. I love it. Dr. Hani, from your perspective.
You can make a difference and you need to start today. And that relates to both, we know we have folks that are business leaders that are tuning in. We also know that we have health professionals and folks in the nonprofit sector. Inform yourself, worked with those who've experienced trafficking to create the solutions, but you can make a difference.
Absolutely. So I want to thank everyone who's been listening in on this session. I want to thank Dr. Hani and Abby for joining us. If you're hopefully inspired by the fact, certain that healthcare must be at the table when it comes to addressing human trafficking, and even in your local community, your state, your country. And there are many people who've been plowing that field ahead of you. So don't feel like you've got to go now and whiteboard solutioning or try to create resources. They exist. They are available to you. You've heard about some amazing ones, even on this call today. And I'm sure, I know from our perspective, you're welcome to knock on our door. You're welcome to knock on Heal's door, on Abby's door, to just start that conversation about what this could look like for you to lean into this work. We know that when you do that, it will save lives. It will improve outcomes of survivors. And together, I couldn't agree more. We can all make a world of difference on behalf of this issue. So thank you, Dr. Hani and Abby, for joining us. And we'll now get ready for our next panel in this event today.
I want you to stay. How do we take that off? How comes we can't hear Molly?
You would think that I would know this after 2 years of doing Zoom conferences, but I am so sorry I did not unmute myself. Hi, I am Molly Thorson. I am with A21. We are a global nonprofit. We operate in 19 locations in 14 different countries. And we work here directly in the United States in advocacy, reach, and restoration. So we want to say thank you so much to the Chamber of Commerce for having us here today. We are so grateful. Our partnership with the Chamber goes far back in helping build one of their identifying the best practices in identifying labor trafficking within businesses. So we do have that toolkit available with the Chamber. So we are so excited today. Specifically, we are going to be talking about these partnerships. And I love the first panel and the theme of partnerships. And we are so grateful to have two of our partners at A21 here on this panel with us today. That's going to be It's a Penalty and Not Today. The past 5 years, A21 has partnered with It's a Penalty in building out human trafficking awareness and prevention efforts in the host cities surrounding the Super Bowls. Within the past 3 years, we have seen over 80 trafficking victims identified in the host city in the 2 weeks leading up to the Super Bowl. We have seen thousands of employees trained at hotels. We have distributed trafficking awareness kits to over 800 hotels within that local host city. And we have seen over thousands of rearview mirror hanging tags with the hotline numbers in Ubers distributed throughout that trafficking city of the Super Bowl. We are so grateful for our second partner, Not Today, who is here today. And we have joined them in the Alliance Against Human Trafficking and Exploitation. This alliance is made up of 5 nonprofits who are working together to battle human trafficking surrounding the Super Bowl. And we focus on building out a legacy of anti-trafficking efforts in that host city that can last long after we are gone. So I'm so excited to introduce them today. We have Sarah joining us and Linda, and I think Linda has our special guest, Frank, joining as well.
Hi, Molly. Hi, Sarah.
Hi, Molly. Hi, Linda.
So we just wanted to give an opportunity for everyone to introduce themselves. And Linda and Frank, we'll start with you, and maybe you can give us a little bit of background about your organization, how you got started, and just a quick introduction.
Okay, excellent. Well, I too was so encouraged by the previous panel. I've learned so much and just so appreciate just being part of this team and just making an impact and expanding our ecosystems and partnerships. So my name is Linda Reich, and we started the Not Today Foundation in 2019. When we came to Indianapolis, for Frank being the head coach of the Indianapolis Colts, we had a platform and we wanted to use it in a major way. So I'd like Frank to share a few words about that.
Yeah, it was been in the NFL for 30 some years, and we've been from coast to coast, East Coast, West Coast, North, South, all over. And everywhere where we go, we take the same mentality. We're going to go all in, and that means both of us, Linda and I, together. We're a partnership. Coaching is a very demanding, vocation, a lot of hours. But Linda and I really like to dive into the cities where we go. So went from the position coach to coordinator to being a head coach, and that platform just gets bigger. And the NFL is a great platform, and the NFL does so much to give back to communities. It was an easy decision to make when I said to Linda, okay, now that we have the biggest platform in the NFL that we can have, what's the next step? And Linda said, well, it's to start this organization. She had been volunteering and serving in human trafficking in all the cities we had been in. So this was just a natural next step for us.
Yeah, no question. And just kind of piggyback on the previous channel too, similar to Dr. Hani. I mean, I've had childhood experiences, not personally, but in the early 70s, when I was in 6th grade, had a little girl in the neighborhood who was trafficked by all the boys in the neighborhood. And, when you're in 6th grade, you don't know what's happening. You can't even understand all of that. So I've seen the repercussions of that all through my primary years and then through college. And then, as Frank mentioned, we've moved quite a bit through our tenure in the NFL, and always looking for opportunities to serve and grow in this space. So this was a natural fit for us to see what we could do to use this platform, the sports platform, on a large scale to make a big difference, to be part of the solution.
Well, you guys have done incredible work, and I know it's just the beginning. So I can't wait to see everything leading up to the Super Bowl this year. And thank you both for your dedication to this. And Sarah, can we hear a little bit about how you got started?
Yeah, so hi, everybody. And I just want to say thank you for this opportunity to be part of this panel. So It's a Penalty really started around with the run-up to the Football World Cup in 2014 in Brazil. And at the time, I had been running another NGO called Happy Child in Brazil for almost 20 years. And we would work with children that were on the streets and really destitute children that were living in the shanty towns. And we started to notice young girls and young boys, but mostly the young girls, were being trafficked and exploited and sold for sex at a very, very young age, openly on the streets. Some of them as young as 11 years old, and dressed up to look older than they were. And I met this young girl called Rose on the streets, and she was selling herself. She told us her story that really changed the course of what I was doing at the time. And she said that at the age of 11, she'd been sent to the streets and had been caught up with a trafficker very quickly within a few days. And for 5 years, she had been exploited by this trafficker. And she looked at us and she said, please, will you do something to help us? And she said, I can take you to places where they're exploited, they're exploiting children as young as 9 years old. And it just really convicted me. And when I flew back to London, I got in contact with a friend of mine who's an investigative journalist for the BBC. And he made a report. He went to the northeast of Brazil and made a report about what was happening with the run-up to the Football World Cup. And around about that time, the Metropolitan Police got in contact with us because they were setting up, it was confidential at the time, but they were setting up bogus websites to try and stop some of these potential offenders before they got to Brazil. And they asked us for help. And in one of these meetings in Scotland Yard, they told me about a legislation, an extraterritorial legislation, which is provisions in law for countries to prosecute their citizens for, they abuse a child abroad. In other words, if somebody was to offend a child in Brazil during the Football World Cup, they could be prosecuted either in Brazil or when they got back home. And they said to me, if you set up a campaign with the run up to the Football World Cup in 2014, you raise awareness about what's happening and potential potential penalties for offenders, and then kind of promote signs to look out for and a hotline to dial, it could prevent up to 95% of children being abused and exploited. And I just felt I'd been handed a gauntlet at that time. And that's when It's a Penalty was birthed, with a run up to the Football World Cup, and A21 joined us at that time.
It's such a moving story. And it just is a reminder as to why this panel is also so great. With the last panel, we talked about the health workers being that front line of defense and identifications. But then we have this panel that's also working and helping with identifications and preventing human trafficking happening through awareness and all these efforts that we're doing in distributing the hotline number. So thank you both for that introduction and talking about the organizations that are working so hard to combat human trafficking, specifically in the Super Bowl host city. So just moving on to this year, 2022, we have Super Bowl 56 in the city of Los Angeles. So all of our efforts here on the panel are working to make sure that we prepare that host city with education materials, with prevention efforts, with trainings, and public awareness. So in these next couple of questions, we're going to go a little bit deeper into that. And Sarah, I'm going to start with you. We know that prevention efforts can be categorized in many ways, but most certainly education and awareness. It's a Penalty was designed to harness the power of sports to bring education and awareness surrounding human trafficking. Can you explain to us why it's so important to bring prevention efforts surrounding the Super Bowl and what businesses watching can do to further these efforts?
Yeah, so, the Super Bowl is one of the biggest sporting events in the world, and it draws, in an audience of millions. So the reason it's so important to work to bring these prevention efforts is really twofold. Firstly, because we know that human trafficking is the fastest growing illegal business globally, and it exists everywhere. So no city or country is exempt. So, and also where there is an influx of hundreds and thousands of people, for a major sporting event like the Super Bowl, unfortunately, the demand increases and the traffickers know this. So It's a Penalty works with the sports industry, the travel and tourism industry, government, local government, and law enforcement and NGOs to cover the travel touch points of the host city, contextualizing our messages, and working together to raise awareness about human trafficking and exploitation and the penalties for offenders and the signs to look out for and the hotlines to dial to prevent human trafficking and exploitation for a safe and successful game. And I think, businesses can really play a very important part to further these efforts. At It's a Penalty, we partner with the airlines and airports and sporting governing bodies like the NFL, the hospitality industry, including IHG, hotels and resorts, Motel 6, the Hilton, Airbnb, AHLA, taxi rideshare companies like Uber. But we need more businesses in the travel and tourism industry to partner with us. And we need more businesses in the sports industry to partner with us, and those businesses that are sponsoring these major sporting events as well. And then other businesses, who can really get behind us and support us, and to become part of what we're doing for a greater impact, not only through, for example, funding, but also, for example, seconding staff with a certain skill set, or running an anti-trafficking, course for staff and management, sharing our video, which we're going to see in a minute that's going to be, that's just been launched today ahead of the Super Bowl, supporting the campaign on social media, Because if human trafficking is the fastest growing illegal, industry in the world, we all need to be part of the solution, which is what we were hearing earlier from the other panel. Helping not only to prevent it through educating and equipping and encouraging reporting, but to reduce demand in order to leave a positive legacy after the game.
Yes, and absolutely. I'm really looking forward to showing that video. I know it is the first time it's going to be seen. So the launch of this campaign is actually today. So I'm very excited to see it. And all the work that you're doing is so significant. And I think you made a phenomenal point that a lot of the businesses you are partnering with aren't just directly through funding. They're offering up their services that they have. They're doing in-kind donations, really just doing what they can with what they have to be a part of that fight against trafficking. So I'll just go ahead and move on to Linda and Frank. Oh, actually, I think we're going to play the video. So, so we'll look forward to seeing that.
Sport brings people together.
Millions of people are trafficked and exploited around the world.
It is happening in the places you call home, the cities you visit, and the events you attend.
We stand with It's a Penalty against the exploitation and trafficking of vulnerable people.
Offenders will face prosecution in the United States
or when they return home.
If you see signs of exploitation by force, fraud, or coercion, call or text this number.
Your call could save lives.
These crimes will not be tolerated. It's a penalty.
Hey, well done, team.
It's wonderful. I love the video. It's great. It's always so great to see every year is different. It's kind of catered to the city that it's playing in. So I love seeing this video. And obviously at the end of that video, we do see the Alliance Against Human Trafficking and Exploitation, which Not Today is a part of. So Linda and Frank, I just want to go to you all. Well, one, we saw in the video, we have these ambassadors, these MVPs, these people who are kind of just cultural icons, using their voice to stand up against trafficking. And that's what you guys are doing as well. And it's really just phenomenal to see, because you didn't have to do this. You're obviously in the football world. You don't have to battle trafficking, but you too found it on your heart to battle trafficking, and specifically child sexual exploitation, which I want to go further into what you guys are doing to battle that. So I'll just go right into it. Obviously, Not Today has a unique position in the anti-trafficking efforts leading up to the Super Bowl, being from an NFL family. You are one of the nonprofits that's a part of the Alliance Against Human Trafficking and Exploitation. And this year, the Super Bowl host city in Los Angeles, you're focusing on combating childhood sexual exploitation. Can you go into what you were doing to lead these efforts? And just like we asked with Sarah, what can businesses do to support your efforts and to be a part of this change as well?
Well, yes, love the video. And it's just an amazing opportunity just to be part of the solution. As I mentioned, during the Super Bowl, we're going to be distributing an educational parent and child care protection guide, which will be available in both English and Spanish translations. And this was really, it really evolved due to all of us moving over the country and having 3 young daughters, dealing with some of the issues of new neighborhoods and the challenges in neighborhoods, what to look for, red flags, technology, groomers, all the things that kind of surround protecting a child. And then in addition, because I saw the implications, and I call it the shrapnel of embedded into children, into adulthood, that transcends into adulthood, that is really long lasting and imprinted as a result of child abuse, exploitation, and trafficking. So this parent and educational protection guide will be available at the Super Bowl. Both our QR code will be there. We will all have an opportunity, the NFL experience this year, our entire alliance, which is fabulous. And we'll be distributing that guide, our faith-based organizations, healthcare clinics, And also, we're going to be working and supporting, in addition, grassroots efforts, like you said, Molly, just trying to leave a lasting legacy in South LA and the LA area in general, so that we can support them on the ground, so they can sustain this type of work, not just kind of parachuting in and leaving, but trying to do something that's going to be in a lasting impact. This year, Frank and I are going to have a wonderful opportunity really to represent the Alliance and also the International Justice Mission at the Super Bowl breakfast this year. And for those of you who are unfamiliar with the Super Bowl breakfast, it is really composed of a breakfast on Saturday morning, highly influential business leaders like yourselves who are passionate about elevating humanity and using their platforms and their resources and their networks of influence to leave their world in the best condition possible, just because they have chosen, like everybody else in this panel and you all listening, to play a part in it. So kind of to piggyback what Sarah had said, obviously business owners can play a part with educating themselves to protect their own families, educating their friends, their employees. Interestingly enough, and I think one of the other gals alluded to this in the other panel, but a friend of ours in North Carolina, when you talk with business owners, they're exterminators. And we're having conversation with them in North Carolina. And they said, you can't even believe what we're seeing in homes. And we wish we knew what to do. So we're going to be partnering with an exterminator company who sees and walks in these houses. So that's just one aspect of how a business can really educate their employees. What to do, what to say. If you suspect nefarious activity in a home, how do you handle it? So yeah, distributing the QR codes, parent caregiver protection guides, seek further information. Obviously, the other panel had incredible resources. It's a penalty, A21, U.S. Institute Against Human Trafficking, has incredible resources. Please take a look at it. And then another thing companies can do and corporations can do is provide safe gaps on technology. Technology is a major with the pornography that is available right now. So putting stop gaps on that, because it's a driver for luring predators and predators luring children. So that's a big deal. Acquire signage for your windows. Train your employees on red flags. And lastly, obviously, financially supporting organizations who are really pushing and driving these efforts. Do you have anything to add to that?
No, I just think, like you said earlier, the encouraging thing is when it comes to the sexual abuse, exploitation of children, what we have found is that people want to help. I mean, there's so many great people out there of all walks of life, all businesses on so many levels. And like us many years ago, it's like, hey, we have to do something about this. But what we're trying to do, and in partnering with the other organizations is the Alliance, is give people tangible things to do. And we're very encouraged by the support, by people stepping up and wanting to play a part in the solution.
Yeah, absolutely. And just lastly, and I think Sarah alluded to this too, I mean, this isn't just a big Super Bowl event. I mean, everybody needs to know this is, I think, really, it has evolved as far as awareness. I mean, it wasn't up until around 2010 where we really started talking about this in the United States. And it's a 24/7, 365-day issue in our country today.
Yeah, absolutely. And just as someone who has seen your parent guides, they're phenomenal. I would encourage everyone to go to Not Today and take a look at that. Your guys' work is so significant. And I just want to emphasize that child sexual exploitation, because there's always so much confusion when it comes around to child sexual exploitation. But at the end of the day, as we know through our work in the past 3 Super Bowls, I believe we had over 80 identifications of survivors in the hotels in the host city leading up to the Super Bowl. The majority of those were children from the missing children's list. So we know this is happening. We know that these children are vulnerable, and they have those key identifications that lead up to being subjected to trafficking. And it's phenomenal the work that you guys are doing to educate people on what those identifications are and how they can protect their children from becoming that a potential child of trafficking. So thank you again for everything you're doing. We're just so excited to work with you guys these next few weeks too, leading up to the Super Bowl. Sarah, I'm going to go back to you. In your last question, you spoke a bit about partnerships. The It's a Penalty campaign has a large list of partnerships and collaborations ranging from our founding partner, A21, to anti-trafficking organizations, to other businesses like Hilton, IHG, Uber, American Airlines, and even the American Hotel and Lodging Association. Can you explain why different partnerships each have a unique role in building out this campaign and why these collaborative efforts help amplify awareness in the host city?
Yes, I mean, I think that different partnerships each have a unique, role, for the It's a Penalty campaign because of the nature of who they are and what they do. For example, to cover the travel touch points in a host city, It's a Penalty partners with airlines. And this is crucial because we can reach passengers as they travel to the host city. American and Southwest Airlines have worked with us now for a few years during the Super Bowls and are currently showing the 30-second film, the campaign video that we just saw. I think to have the NFL stars like Johnny Hecker and Chris Godwin, it kind of helps to communicate a subject that is otherwise quite difficult for people to hear about. And then we partner with airports, and this year we have a partnership with LAX. So when people arrive at the airports, they then will see the same messages again. We've got digital signage throughout the terminals and also hand mirror clings in 460 bathrooms throughout LAX with the same messages. And they've actually told us they're going to leave them up until they fall off, which is great. And then we partner with taxi ride shares like Uber, who display rear view hang tags in the shape of football helmets with the hotline. And then, as you mentioned, It's a Penalty also partners with the hospitality industry. And in LA, we're working with IHG, Hotels and Resorts, Motel 6, the Hilton, AHLA, the California Hotel and Lodging Association, and the Hotel Association of Los Angeles and Airbnb. And in fact, on Wednesday, we have our It's a Penalty campaign launch with the hotel industry. And we're going to be distributing human trafficking awareness kits designed to help hotel staff and the public to spot the signs and know the reporting hotline. And then during the launch, there'll also be more targeted training for staff management led by A21 and AHLA. And, It's a Penalty also partners with the NFL and the host committee, which is so important because it's their sporting event and they want to run, a safe game and to leave a positive legacy, as do the local government and law enforcement. And in Miami, Tampa, and now Los Angeles, we've gained the support of the attorney generals. And finally, as I've mentioned before, it's so important for us to partner with local NGOs like, Not Today, to contextualize the campaign. These collaborations are just, they're collaborative efforts to help amplify the awareness in the host city. And I think working together, as we've said, is so much more impactful because it sends a powerful message that we're all working together. And I think that's reflective in our impact results, where we reach approximately 180 million people per campaign. And on average, we see an increase of between 130 to 300%, of increase of calls to the hotline with the run-up and during the game, during the Super Bowl. And last year, during the campaign we ran in Tampa, 85% of respondents felt more equipped to report crimes of trafficking as a result of being exposed to the It's a Penalty campaign.
I mean, the numbers speak for themselves. It's such a powerful, impactful awareness campaign. We just were able to look at the Polaris hotline data from 2020, which was just released on January 1st this year. And those numbers indicate that California is the #1 state in identifications of human trafficking. And in fact, they make up nearly 15% of the nation's human trafficking cases. So taking all these awareness efforts and making sure they reach Los Angeles is not only significant surrounding the Super Bowl, but it's going to be super significant in just combating human trafficking in the United States in general. And like Linda mentioned earlier, leaving that local legacy as well, making sure that these Californians are safe from an influx of travelers coming into their state, and protecting them from these instances of trafficking. Phenomenal work, Sarah, as always. It's always so fun to hear the impact reports every year because I know it's such a hard, long work leading up to the Super Bowl, and it's really wonderful to hear all the numbers. Linda, going back to you guys and looking at the Super Bowl, it's wonderful to bring, like we said, all of this into the host city, but as you mentioned, traveling with Frank around the United States and moving around for work, you've landed in Annapolis, and the NFL has really supported your efforts. But how really have you expanded your efforts in the city of Indianapolis specifically, and how has Indianapolis rallied around this cause? And how could this be a blueprint to other cities who kind of want to replicate that model?
Yes, well, it has been just really a privilege, and we've been so blessed and encouraged, as Frank has mentioned. I mean, the state has really been supportive and encouraging and wanting to do what they can to support these efforts with trafficking. With Not Today, there are just so many efforts that we're focusing on right now. I mean, we're doing grassroots community efforts. We're going into local communities and talking and sharing and giving literature. Just working, obviously, funnel up and funnel down. We're working with our local law enforcement, working with DCS. We're working with our state representatives and our legislators to just to bring about legislation changes. Right now, we're working on government toolkits. So that way somebody can go to indy.gov and they can know what to do if somebody trafficked, or have a plan of action, or have a hotline number. So we're working on that. Also, as somebody mentioned, obviously we're working with the healthcare industry. We're working with the hospitals. We're working with DCS. We're working with the local advocacy and children's centers. It takes all of us. And just like with any NFL team, I mean, it's kind of a recurring theme for all of us. I mean, it's such a big issue that it takes all of us in collaboration, everybody just doing their parts. Nobody, like we said, we just want to do what we can do. It's not about a show. It's not about look at me. It's not about who can get the most track. It's just about making a difference together. How can we support one another and really be in collaboration with partnerships? That's why it's such an honor to be with this alliance this year for the Super Bowl, and the work that you all have been doing for a long period of time. We're relatively the new kids on the block, and we are so honored just to play a part with you all, because you have been working so hard in this venue for such a long time, and we are just delighted just to make a huge impact. And I think it has to be all these ecosystems, as someone has said, must align. And it's just about getting people and getting a seat at the table. And that's what we're really trying to work on. High profile people who can help from the top down and also the bottom up. I mean, everybody needs to work together. So it is a team effort.
I mean, the support from the city sounds phenomenal, and it sounds very specific to Indianapolis. I mean, few cities and few organizations can say that the city rallies around them the way that Indianapolis has rallied around you guys. And I think that speaks volumes to the work that you do, and the impact that you are having locally. And we're excited to work with you to expand that into the city of Los Angeles. And like you said, with our alliance partners, and I do want to mention the full alliance is the U.S. Institute Against Human Trafficking. It's a penalty, A21, Not Today, and Inner City Visions. And it really, like you said, is so cohesive, and it's so wonderful to be able to use everyone's abilities and capabilities to build out a better program to build human trafficking awareness efforts within the host city. Each year we do these efforts around the host city, but we know that, as we mentioned, these partnerships with businesses, that same partnership applies to the local government and local law enforcement. So, Sarah, each year It's a Penalty is leading efforts to assist law enforcement to identify victims and arrest perpetrators. This past week, we saw one arrest that was made in Tampa during last year's Super Bowl that led to a sentencing of 25 years for one trafficker. Why is law enforcement a critical partner to It's a Penalty's efforts? And what tips can you provide to businesses that may be hesitant to reach out to local, state, and federal law enforcement on this issue?
Yes, I mean, human trafficking, as we all know, is a crime. So it's crucial that we work with law enforcement in the host cities. But also, we partner with NCMEC, the National Center for Missing and Exploited Children, who also work with the law enforcement as well. And as part of those kits, those hundreds of hotel kits that I mentioned earlier that we're going to be distributing to our partner hotels and motels with this week, with the run-up to the Super Bowl, NCMEC have provided us with a list of missing children in Los Angeles, girls under the age of 18, some as young as 12 years old, who've been missing in this area for the last 2 years. And, you know, in Tampa last year during the Super Bowl, 18 of these children that were on a similar list that was distributed around the hotels and motels were identified. And most of those missing children that were identified were verified by NCMEC to have been reunited with their family. So that was great. It just makes it all worthwhile. And NCMEC's cyber tip line is the nation's centralized reporting system for the online exploitation of children in the US. And the public and electronic service providers can make reports of suspected online enticement of children for sex abuse and exploitation. And if you call the tip line, the NCMEC staff review each tip and they work to find a potential location for the incident that's been reported so that it may, you know, be available to the appropriate law enforcement agency for possible investigation. And It's a Penalty also works with Polaris, with the national, trafficking hotline across all our materials. We promote the national hotline across all our materials, and also, as you saw at the end of the video, campaign video. So I think my encouragement to businesses is to familiarize yourselves. You know, human trafficking is a global issue. And, you know, it's so important to be an ethical, as part of being an ethical business, it's key that you make your staff and management aware of the signs to look out for and the reporting hotlines. And they're available on our website, itsapenalty.org/make-a-report, as are the list of signs.
Polaris and NCMEC are such phenomenal partners, obviously, with the National Human Trafficking Hotline and the NCMEC hotline for minors and identifying minors in the cases of child exploitation. I also I have an inside tip that some of the businesses that you have been partnering with, such as the Los Angeles Airport, LAX, have their own security that is focused on building out human trafficking prevention efforts. So can you talk a little bit about what LAX is doing and how you're working with them to ramp up their efforts with their security?
Yeah, so apparently their security, in fact, when I arrived at LAX 2 days ago, the guy at immigration said that he'd done the training, the anti-trafficking training, so that they've trained all, you know, their staff to spot human trafficking with the run up to the Super Bowl. They've also, throughout the terminals, as you arrive, you'll see digital signage with the NFL stars, and also the national hotline, which is amazing. And then in 460 bathrooms, as I mentioned earlier, they've got 1,000 miraclings, again with the national hotline. And then tomorrow we've got a press conference where we're going to be talking about the travel touch points that It's a Penalty campaign covers. So we're looking forward to that as well.
I just love hearing about how businesses can incorporate anti-trafficking measures within their own security programs, not even just with local, federal, and state law enforcement, but building out that within their own teams. And Linda, we know that Not Today has done incredible efforts with mobile clinics, and specifically with assisting law enforcement with their K9 unit. So we know that you've been working with law enforcement as well. Can you expand on your partnership with law enforcement? And similar to Sarah's question, what tips can you provide to businesses to start engaging with law enforcement and build out these successful partnerships?
Yes, it's been pretty exciting. We've been working with the Fusion Center in Indiana, and they basically are working, obviously, with the larger administration, just talking about how we can help and what are their needs. So we met with a number of police forces in the area, and a big need was mobile forensic units. So they're able to, when they get cyber tips of children who are potentially being exploited or trafficking situations, then they can take these mobile units, they can go on site, bring the child out of the situation, and then we have our K9 hunter, who is phenomenal. Never would have imagined a dog, just like they sniff out drugs at the airport, these dogs can sniff out the chemical that is in the technology of phones, iPhones, and also computers. So if there's any child pornography or any type of producing pornography and they've hidden them at homes, these dogs can sniff them out in the craziest hidden places that I've seen, under floorboards, in pineapple cans and refrigerator, up tops in vents. The dogs can find these things because they're so small that the normal forensic unit police force cannot. So these task forces have really been supplemented by these canine dogs. We're going to be working on purchasing our second unit for the another police force, so that they can go in with these investigators and take the children out. They have all the technology right in the mobile unit, and this will enable them to immediately download the information, and they can prosecute immediately if they have these mobile forensic units on site. Typically, without the mobile forensic units, they have to go back to their offices, go back to the forensic units, and then it takes sometimes months to be able to prosecute. But with these mobile forensic units, they can get the information, get the nefarious data, and they can prosecute immediately. So it's really been so humbling to be part of something that you see immediate impact. It's just really a privilege. And then secondly, as far as businesses, the big why for all the companies. I mean, why for all of you who are listening, business owners, the why. Number one, Sarah said, it's a crime. Number one, it's a tragedy against humanity, and it needs to stop. When children are traumatized in this way, it leads up through serious mental health issues, in many cases through adulthood, leading to all kinds of toxic and negative coping mechanisms like drugs and alcohol and serious relational issues. And many times it's generational, and generational abuse can happen. It's estimated that it costs a community over $100,000 per year to restore a child who has been sexually abused. So from a civic-minded standpoint and from a community standpoint, it's the right thing to do. It's something that caring, decent human beings should want to do. And when we talk about getting together and really embracing a social justice movement, this is the next social justice movement that we should embrace as a country and get behind it on a big scale. So for all you business owners who are listening, panel, healthcare, thank you for what you're doing. We appreciate your support. We need your support. We need you to come alongside and really be a team member for this issue, because it's a big issue and we need all of us to make an impact.
Well, Linda, that's phenomenal. I love how in your opening statement you mentioned how you got started in this was seeing that trauma transition from childhood into becoming an adult. And now it seems like your efforts are specific. For us at A21, we have our child advocacy centers, and we know that a huge part of eliminating that initial trauma for these victims of trafficking who are minors is that forensics and that initial impact and initial report. So that mobile forensic unit is so impactful for your community and is going to make a huge difference in not only bringing traffickers to justice, but like you mentioned, eliminating as much of that trauma as you can with that initial exploitation. So phenomenal work for both of you. I think this has been so wonderful for all the U.S. Chamber members to hear what's going on to build out these efforts surrounding the Super Bowl, what you both are doing to prepare the city of Los Angeles and your hometowns, and what we all can do to build out our own education and prevention and awareness efforts. We have just a few minutes left, so I just want to do, as we did on the first panel, a final takeaway. If there's any last thing you want to share with the audience, Sarah?
I think it's just to really encourage you to say, please get involved. Please familiarize yourselves. Like I said, and as it is, it's such an issue globally. It's only when we come together that we're really going to see a change. And so it's an encouraging, please get involved.
And Linda and Frank, anything from you guys as a last statement?
Yeah, I just echo two things that really have already been said. Just number one, the team aspect, so important. That we all can make a difference, and how that happens when we do it together. It just exponentially works in ways that we can't. It goes beyond what we can think or imagine. But then the other part, the individual part that I think is so important, is that we each one of us has to take initiative. We have to take initiative. It's so easy. Our lives are so busy that, we know this is important. All you have to do is just start talking about it, and it just immediately tugs on our heart. And so, no one of us can do it alone. No one of us can save the world. But if we can just find a way to budget out some time to say, hey, one day a week or an hour a week or 30 minutes or 10 minutes to initiate something in your company, in your family, to be proactive, to be intentional, it's just so important.
Wonderful.
Yes, no question. And I would echo just tying us all together. Just everybody can make a difference if we work together. And this is a social justice issue that we can all get behind and should all get behind for the good of humanity and the good of our country and world.
Well, wonderful. Thank you both for being here today. Thank you to the Chamber for having us. I look forward to working alongside both of you in the weeks coming up and working further with the Chamber. So thank you. Back to you, Michael.
I'm Michael Billett, Director of Policy Research at the U.S. Chamber of Commerce. First, I would like to thank our moderators and our partners for this event, Ashley Chapman at AFRJ and Molly Thorson at A21, and representatives from the following organizations: Heal Trafficking, It's a Penalty, K-Not Today, and Anthem Incorporated. For our audience, I would like to say the following. Human trafficking is wrong, it's immoral, but we know we don't exist in a vacuum at the U.S. Chamber of Commerce. And as you heard from both panels, it is a criminal enterprise, and any criminal enterprise is not only detrimental to society, but it's also a barrier to economic growth. So if you'd like to join us in our mission at the task force, we're doing lobbying and advocacy, we're raising awareness through forums such as these, and we are also engaging in survivor empowerment, which is why with AFRJ, we are releasing our toolkit with the following companies: Anthem, Metro Atlanta Chamber of Commerce, Metro Atlanta Chamber of Commerce, and other organizations. Thank you for tuning in today's event, and we hope you'll join us for our next event in the spring. With that.